Well, thank you very much for everybody for coming this morning, and thank you all very sincerely for your wonderful contribution to our cause. Just a quick hand up of those who have already signed up to the Workplace Giving Programme. Thank you very much indeed. That's tremendous. And just out of interest, how many of you have been to Ethiopia? Not a lot? Anybody in Camden been to Ethiopia? No. Well, you've missed a lot of very interesting things if you haven't been there. That spot where those three children photograph was taken, I've actually been there a couple of times. It's on the way to a town called Asaita, where you can actually have a cold beer, would you believe? But my sister Valerie, who went to Ethiopia first in 1973 with another nurse, interestingly, from Barrel, in 1973, she trained, by the way, at the Children's Hospital at Campbelltown, and they went as children's nurses in that year to help when there was a big famine on at 1973. And she got bitten by the African bug and kept going back and back. And we, of course, are concentrating on maternal health. And the big problem there is the maternal deaths. That's the official maternal death rate in Ethiopia just a few years ago, and it was then approximately 100 times what it is here in Australia. So the majority, well, all those deaths really are preventable. In Australia, we've got a very, very few maternal deaths happening in pregnancy and childbirth, which are unfortunately unpreventable, but that's that very, very tiny amount on the left-hand side. But 100 times of that number are preventable deaths in Ethiopia. And in fact, in my sister's area, in the Afar, that figure is higher still. And it was estimated really quite accurately that any woman had a 1 in 12 chance of dying as a result of trying to have a baby. In other words, through her reproductive life, 1 in 12 of all those women having babies would die. And they would die from the preventable causes in pregnancy, particularly hemorrhage, infection, and eclampsia. Those are the three big ones. So, as you heard Alison say, we founded the Barbara May Foundation back in 2009 to try and to do something about maternal health for my sister Valerie. What had happened was that my son Andrew had been working with Dr. Catherine Hamlin for 10 years in Addis Ababa, mending the birth injuries, the fistulae, and in 2005 he and my sister Valerie got together and said, how can we have a cost-effective way of cutting down the maternal deaths and the birth injuries. Now the birth injuries actually are 30 times the number of maternal deaths, so you can imagine how many fistulae actually occur. It is thousands and thousands. And they worked out a very simple 3-tier system of maternal care, of upgrading the traditional birth attenders so that they would be more aware of the potential complications in pregnancy. They'd be working in the bush, in the little nomad villages, and they would refer patients to waiting areas if they found a complication, or potential complication I should say. And then there would be fully trained midwives in the waiting areas along the highway, and they would refer them on to the hospital if they couldn't be delivered in the waiting areas. And this is the beginning of the building of the hospital. And so you can see in Ethiopia, building is done mostly by hand. So digging the foundations, no mechanical aids, it's all done by hand, so it's fairly sweaty work. And the temperature there, incidentally, often goes above 50 degrees Celsius in the shade, so it is fairly warm. The cause of the problems in labour with the fistulae and so on is that if the baby's head is not in the right position, if it's a little bit too big or whatever, then the labour might go on and on and on for several days, and that if the labour is prolonged for days and days, then of course the pressure of the baby's head on the mother's tissues causes that tissue to die. You get necrosis, and eventually of course you get a hole in the bladder or maybe the bowel as well.
The Afar region of Ethiopia is the hottest inhabited place in the world. More women die here in childbirth than anywhere else in the world. The Barbara May Hospital is one of 2 hospitals providing maternal health care to a population of 1.5 million people.
When my mother died, she said, one thing you need to know is that Brownings do not agree with mothers dying in childbirth. And if what Valerie says is true, the Browning family must do something.
In Ethiopia, the maternal and fetal mortality and morbidity is high. Women fall pregnant and have to travel extreme distances to get access to quality maternal health care.
Maternal death in Afar is higher than anywhere else in Ethiopia. It's probably one of the highest in the world. Afar women have been left out, as it were. So the maternal health has been left, as the Afar would say, in the hand of God.
The Afar, in their whole history, have never had access to good, safe obstetric care. So delivering in a hospital is very foreign to them. It's their culture to deliver at home. When my aunt started there, it was 2% literacy. Language wasn't even in writing. I mean, 1 in 3 children were dying before they were 5, 1 in 12 women were dying from pregnancy. The only way to prevent a fistula is to ensure that a woman has a safe delivery. Midwives are the key for that. They're the ones that are looking after them antenatally. They're the ones looking after them during labour.
The challenges that women face during their pregnancies can be detrimental to their health and the development of their babies.
We don't notice the progress of labor in home if she delivered and not the presentations of fetus, then can get obstructed labor or prolonged labor. If you have more experience, we can decrease the maternal deaths and the fetal deaths.
Most Afar women arrive at the hospital with serious obstetric complications after 3 to 7 days of labour.
Once they decide to look for medical advice and medical service, there is no transport access. Problem with the infrastructure to go into that specific health institution. They don't get the proper service timely. The purpose of the hospital is responding to maternity service primarily, and as a gynecologist as well, we do intervene with gynecological problems. But primarily, we give priority to obstetrics services. That means pregnancy and pregnancy-related complications.
Malnourishment and malaria cause anemia in many pregnant women in the Afar region. An iron-deficient diet leads to complications during pregnancy.
By the time a woman does get here, she's maybe been in labour for days elsewhere and come as a result of a complication. It's those women, when they run into complications, that access the health care from the midwives here at the hospital. It's not your average normal patient you're dealing with. Generally, it's a very compromised patient. People are very, very low in iron, so they can't cope with a normal miscarriage, let alone a postpartum hemorrhage. Access to antenatal care will reduce maternal and neonatal mortality and morbidity. For us midwives, the partograph is our gold standard. It helps us to monitor the mum, the baby, and the progress of labour all together.
The hospital in Mile offers comprehensive obstetric services. Routine tests such as hepatitis B and hemoglobin enable the midwives to treat their patients immediately.
Afar baritoluk masuginaya, afar baritoluk masugoy, lahtinna, garbol yamarak sukte, barito gana hawai kenik dadalta, kadulak elledalaninna awai barinni hakimil dalanam, hakimil dawatani, hatoddetanim, hakinkinim awai barinni. O afarai elle garbol elledalasi taksuktekka, hakiluk masuginnai, baritoluk masuginnai, اللي دلاسيتا ربطة مربا رعتا الراعة اللي قربونو يندري مركهاي كما سوكينو أواي بريني حتى الندودنها.
We have to know what's happening to the baby. We have to know what's happening to the mother all through the pregnancy.
Emergency obstetrics is the reason why the hospital is here. Each maternity case that comes in, probably 60% are life-saving ones. If she didn't come, she would have died.
What we're aiming for in the hospital is not just to train excellent AFAR midwives and nurses and so on. It's more than that. It's to train the community in the awareness of what maternal care, what safe motherhood and what female reproductive health is all about.
If we got midwives who are fully capable of practicing their midwifery profession, in up to 80 to 85% of cases can be managed by midwives.
Future hopefully is a world where all women have access to safe medical care to have a baby, to prevent babies dying, to prevent mothers dying.
So that's the project which you at Campbelltown Hospital and all the other hospitals in the South West Sydney and in the Sydney local health districts are supporting. I have to say that unfortunately we've got even bigger commitments with Valerie now, because as of the 30th of June this year, in other words 4 months ago, the government aid for her rural work was cut completely, and that amounted to something like $400,000 a year. We, this is the Barbara May Foundation, have taken on some of the rural maternal health care work, and so that's an additional burden. So obviously we're looking for an expansion of our donor base to support all that. And incidentally, volunteers are always welcome. We've had a number of obstetricians and midwives from Sydney who've gone out there, several from Barrel, several from one or two from Royal North Shore, certainly a number from Royal Prince Alfred, and others from all various parts of the country, and also from overseas have gone as volunteers to do the emergency operations and to teach the local people. So the standards in the hospitals in both are really outstanding compared with the government hospitals in both those countries. It really is a wonderful achievement, I believe. So thank you very much for listening and watching, and trust you've got a better idea of what actually happens in that part of the world.